Hello, welcome to STAT's second installment of our 2022 Status List Spotlight Series, Blazing a Trail for Transgender Rights, featuring Admiral Rachel L. Levine, and sponsored by YouTube. Thanks for joining us. I'm Nick St. Fleur, a general assignment reporter and associate editorial director of events here at STAT. And I'm sure you all know how to use Zoom by now. But before we get started, let's run through some quick housekeeping items. At the bottom of your screen, you should see several icons. Use the chat feature to chat amongst yourselves or to send a message directly to the STAT team. Please do not put your questions for us in the chat. If you do have questions, and we really hope you do have some questions to ask, we'd like for you to put them in the Q&A feature. That way, we'll be able to answer them live. In the Q&A window, you should be able to see the questions that other attendees have asked and upvote the questions you would most like to see answered. We'll be doing our best to make sure that your questions are answered throughout the conversation, so don't wait until the end to submit. Submit them as they pop up in your head. This is part of what makes these events so fun and engaging. We want to hear from you, and thanks so much for being here. Before we get started, I'd like to welcome Dr. Garth Graham, Director and Global Head of Healthcare and Public Health and Head of YouTube Health, for a sponsored introduction of today's event.
Thank you, Nick. You assumed we all knew how to use Zoom well, but apparently I am in the still learning minority. So I can't tell you how excited I am to be here and first be sponsoring this series and to hear from one of public health's giants and greats, Admiral Rachel Levine, and just the work she's done with the state level and then the trailblazing work being done now at the federal level, addressing all kinds of issues from disparities to COVID to climate change, et cetera. And for me personally, we've been part of a lot of the kinds of efforts and work around addressing determinants of health. Not just the issues around social determinants of health, but also looking at this issue of information as a driver of health outcomes and how information helps to empower communities to make healthier decisions and be able to do that at scale. And this has brought more even to bear, as many folks have seen with the COVID pandemic, but also with a number of chronic diseases across the board. And we need to consider how people access information about their health, the quality of that health information, how easy it is to understand, and how engaging is it as well. The truth of the matter is the majority of healthcare, public health, happens not in the doctor's office, but outside in communities. And we need to think through how we're part of how patients, communities, the broader public gets information that empowers them to make healthier decisions. And health education can come in many forms. And we've seen firsthand just how powerful video can be as a medium to reach people with health messages. And really, that's what our mission is here at YouTube and what we're doing across Google, especially with YouTube Health. And the mission for YouTube Health is to provide equitable access to highly authoritative health information that is evidence-based and culturally relevant and engaging as well. We're doing this through two key focus areas: improving information quality and also improving information equity. We believe that health leaders have a responsibility to keep pace with the changes in where people get information and how they get information, to be a part of that journey. And if part of that journey is in a community, that's one aspect, but also realizing part of health journeys happens online. And how do we make sure that we have the information that meets people's needs and helps them to, again, make the right decisions at the right time? So we've already become a part of people's lives and reach them in the moments that matter. And so thinking that through at scale is really what our role is in terms of our efforts at YouTube Health. An example that we wanted to highlight is through one of our partners, the American College of Physicians, which has used our platform to address misinformation around vaccines and provide evidence-based scientific information about the safety and efficacy of vaccines. They have created information that reaches both physicians and patients. And the physician-to-physician conversation in particular, they've used that to support physicians and other healthcare professionals with effective communication strategies to build confidence both in vaccines and other areas around health information and misinformation, and address many of those concerns. So what we see across the board is a capacity of technology and video to be an effective format for sharing health information in ways that are accessible and digestible, not only to professional audience, but to everyone. And regardless of health literacy or language, we should be able to reach communities with information that's engaging and easy to understand. So we're excited about our work. We're excited to partner with STAT. And I'm particularly excited to learn more about Admiral Levine's work protecting communities across the board around health, public health, and all of the challenges that come along with that. So with that, again, we are excited and proud to be sponsoring this series, but more importantly, excited to be hearing about the information today. So I'll turn things back over to Nick to take it away.
Wonderful. Thank you so much, Garth, for that introduction. Here to join me for today's discussion, please welcome a member of the 2022 STAT Status List, Admiral Rachel Levine, Assistant Secretary for Health at the Department of Health and Human Services. Admiral Levine, thank you so much for joining me today. And congratulations on being on the status list.
Oh, thank you so much. I am really so pleased to be with you today.
That's wonderful. And again, we're so happy to have you. So as many people here know, you are the first openly transgender person to be confirmed by the Senate for a federal office and the first openly transgender 4-star officer to serve in any of the country's 8 uniformed services. I'd love for us to kind of start off our conversation by you telling us a bit about your early life and kind of what led you towards this path of being this trailblazer and one of our nation's most visible and vocal transgender rights champions.
Well, thank you so much. It is truly an honor to have been nominated by President Biden to the position of the Assistant Secretary for Health, and then to have been confirmed with a bipartisan vote in the United States Senate. And then an amazing privilege as part of my position as the Assistant Secretary for Health to have the opportunity to assume my commission and the uniform and to lead the United States Public Health Service Commission Corps. You know, I have always been drawn to service and to helping people. And, you know, when I remember when I was younger, was really drawn to biology and science, and then drawn to medicine. And so when I entered college, you know, the goal was to go to medical school. And I had the opportunity to work at a research laboratory at the Boston University School of Medicine. And then went, after acceptance, went to Tulane School of Medicine in New Orleans, and fell in love with pediatrics and taking care of children and families. And then that particular new field at that time of adolescent medicine, taking care of teenagers, young adults. And what I loved most about that was the intersection between physical health and mental health, between traditional medical issues and behavioral health issues. And that's what I've dedicated my career to.
Wonderful, wonderful. And a quick note for the audience, we'll be wrapping up around 2:45 Eastern time. So be sure if you have some questions, get those in early. And I'm actually going to jump to a question that we have from the audience because it works so well with kind of how we started this conversation. Elizabeth Dudkin asks, Dr. Levine, I'm a colleague from Penn State, and I'm so proud of everything you've achieved. As the first woman in a number of different professional situations, I'm curious about how you feel about being the first in so many professional situations. Do you wish your first were no longer a big deal, worth mentioning, or do you enjoy being the kick-ass trailblazer you are?
Well, you know, again, in view of that dedication to service, you know, that includes working for affirmation and empowerment for the LGBTQI plus community. And so I am, you know, feel very privileged and pleased to have been the first Physician General of Pennsylvania that was transgender, and Secretary of Health of Pennsylvania, and now in my current positions. And so I think that it's important. I think it signifies the progress that the LGBTQI plus community has made. And I firmly believe that although I was the first, I will not be the last. And eventually, yes, I hope that that my being part of our community is not in itself something that is noted with such significance. But I am really pleased to break those glass ceilings, so to speak, for others.
Wonderful, and let's dive right into those issues that you've worked so hard on. I mean, As we're surveying the lay of the land as it is right now, what are the challenges faced by the LGBTQI plus community, particularly the youth, and what are the policies or the actions that can be done to improve health, their well-being, especially for children?
So, one of the things that is so gratifying about being part of the current administration is its dedication to health equity. And our president and vice president and our secretary are absolutely dedicated to health equity for all communities, but particularly disadvantaged communities. That includes the African American community, the Latino community, the American Indian, Alaska Native community, but other communities as well, including our LGBTQI plus community. The administration is so supportive of LGBTQI plus individuals, which have really suffered health disparities for many, many years. We had been making progress under the Obama administration, but had lost ground in the previous administration. And it's great to see us bouncing back and of such critical importance to actions from the administration. That includes, of course, particularly vulnerable LGBTQI plus individuals and communities, including those communities of color that I was mentioning, seniors, immigrant communities, and LGBTQI plus youth, who are so vulnerable to bullying and harassment and discrimination. So we're going to be working on really with a number of different levers. One is in terms of advocacy. The president has spoken out, the vice president, the secretary, and myself have spoken out specifically in favor and in support of LGBTQI plus youth, particularly vulnerable transgender and gender diverse youth. We need to be working on policy. That includes the Title IX notice of regulations that came out from the Department of Education a couple of weeks ago, and the Section 1557 of the Affordable Care Act interpretation that came out from our Office of Civil Rights yesterday. And that includes legal action as well by the Department of Justice. And of course, the president supports the Equality Act in Congress. So we need to work on all of those different fronts for LGBTQI plus youth and other vulnerable communities.
You recently had an op-ed in the Miami Herald. It was titled, "Most Florida Residents Support Gender Affirming Care for Trans Youth. For them, facts matter." And you start off by mentioning this poll that found that 54% of Floridians support access to gender affirming healthcare for minors, as you go on to say, like when it's recommended by their doctors or supported by their parents. I'd love for you to kind of elaborate to us about this issue, why you're so passionate about it, and also why did you choose, Florida to kind of, publish this op-ed right now?
Sure. So again, my field is adolescent medicine. And so the medical care of teens and young adults is so important to me. And I know the importance of gender affirmation treatment for transgender and gender diverse youth. These youth are vulnerable and they have higher rates of mental health issues such as depression and anxiety. But there's nothing inherent with being an LGBTQI plus youth, with being a transgender or gender diverse youth, that would predispose them towards mental health challenges. It is that bullying, that harassment and discrimination that they might face in their school or community that leads to challenging mental health issues. And now what we're seeing is actually state-sponsored challenges and actions and laws taken by states which are preventing them from participating in sports or activities, and at their worst, limiting the ability for them to access evidence-based standard of care, evaluation, and treatment for gender affirmation treatment, often performed at expert children's hospitals, including children's hospitals in Texas and Alabama, and children's hospitals really throughout Florida and throughout the country. And so, there have been very challenging politically motivated actions and laws in those states, including specifically actions in Texas and in Florida, and laws passed in Alabama and other states. And so we deliberately and specifically published the op-ed in Florida because of the statements and actions taken by politically motivated politicians there, including the Don't Say Gay bill and then challenging the ability for these youth to access gender affirmation treatment, and even adults to have Medicaid cover gender affirmation treatment. Gender affirmation treatment is medical care. It is mental health care. It is literally life-saving care for these challenged youth. They go through careful evaluation by expert pediatricians and psychologists and psychiatrists, and get evidence-based treatment, supported by the literature.
We have several questions coming in from the audience, but right before I jump into those, I want to ask you, in your op-ed, you talk about, traveling the country and hearing stories from people who are affected by this, who you're hoping to help. Are there any anecdotes from your journeys, from those travels, that really stick out to you that you feel you want to share with us, or
Sure.
anecdotes or stories that just break your heart and kind of keep you motivated to doing the work that you're doing?
So, again, some of my most rewarding work is and has the opportunity to speak to teenagers and their families. Because again, as a pediatrician and adolescent medicine specialist in my academic medicine career, so I have been really throughout the country. I have been to Children's National Medical Center in Washington, Seattle Children's Hospital in Seattle, Washington, Nationwide Children's Hospital in Columbus, Ohio. Other groups that I've met, whether in Texas or Florida, in Atlanta, and really throughout the country, talking to LGBTQI plus youth, to trans youth, gender diverse youth, and often their families. And we have heard really challenging stories. I've seen young people who tragically have been asked to leave their home, essentially, asked to leave their home by their parents because they were not accepted. They ended up on the street. And supported by community organizations, and then by receiving treatment at children's hospitals or LGBTQ health centers. I've seen kids who have been bullied and harassed at school, and have been depressed and suicidal and self-harming. I've just heard these stories that are just so meaningful and poignant, and shows how challenging things are right now for LGBTQI plus youth, particularly these vulnerable trans and gender diverse youth. And so they need to be supported, they need to be affirmed, and they need to be empowered. Now, I said that in my op-ed, and I said that in an interview, and that was twisted. It was said that I wanted to empower youth to become transgender. That is not why I'm saying. Trans youth, it's the transgender, gender diverse, and LGBTQI plus youth who need to be affirmed and empowered. We're not trying to make anybody something that they aren't. We just want to help them be who they are, and to make sure that they're not discriminated against because of who they are and who they love.
Mm-hmm. Thank you for that. And I mean, that does seem to happen often, that people, take your words and misconstrue them. I'm sure you're used to it at this point, but are there any other, I guess, fallacies or mistruths out there that you want to take the opportunity to correct the record, or speak out against?
Well, I want to emphasize that we are in pediatrics and adolescent medicine, and my work in public health. We're trying to help these young people to be the most that they can be, to really to be able to affirm them and support them and empower them to be their best selves and to be who they truly are, and to help them in terms of that discovery and evolution process. We're not trying to ask young people to be trans or gender diverse if they're not. And so that's a fallacy, that what we say has any impact upon that. It's also important to remember that this is not evidence. This is not treatment that is being done haphazardly. This is evidence-based care, which has developed over years, which has a strong evidence in the literature to support the gender affirmation treatment that we're giving, again, many times at our expert children's hospitals. So those would be some of the fallacies and things that have been misconstrued.
But thank you so much, Admiral Levine. We have a question here from Bridget Early. It's a bit of a newsy question. Bridget says, Roger Severino this afternoon blasted yesterday's proposed rule on Section 1557 of the ACA as, quote, woke transgenderism. Bridget asks, I was wondering if you could talk about how HHS plans to use yesterday's rule to challenge the 9 states which currently do not cover gender affirming care under Medicaid, especially given the rise of state legislation to ban access to gender affirming care.
Okay, well, thank you. So Roger Severino was the previous director of the Office of Civil Rights at the Department of Health and Human Services, and he actually completely changed the Obama administration's interpretation of Section 1557 of the Affordable Care Act. So we are completely redoing his misinterpretation and are going back to the Obama administration's interpretation. So we are interpreting this section that when it says that you cannot discriminate on the basis of sex, that means that you cannot discriminate on the basis of sexual orientation and gender identity. And so this rule and regulation, which was proposed yesterday, is now out for public comment. That it has to go through the full approval process. Will interpret all the work done through the Affordable Care Act by all of the different divisions and agencies within the Department of Health and Human Services, including, of course, the Center for Medicare and Medicaid Services. So we will be working to promulgate all of those rules and regulations after this rule is finalized. The same interpretation was made by the Department of Education with Title IX, that when it says for education that you cannot discriminate on the basis of sex, that includes sexual orientation and gender identity. And so our Office of Civil Rights is very pleased to take cases from people who feel that they are being discriminated against because of sexual orientation or gender identity. I am sure that there will be legal actions after this rule is promulgated in terms of states trying to challenge this, and then it'll go to the courts for their say. But it's really critically important work through regulation at both of our departments of Health and Human Services and Education for these rights for the LGBTQI+ community.
Thank you so much. We have 2 questions here that are pretty similar, so I'll ask them both. Megan Crawford Holtz asks, hi, Dr. Levine. As someone who is involved with LGBTQ plus advocacy and a direct healthcare provider, what advice would you have for clinicians wanting to move from patient care to more of a research and policy role? And you can answer that one first, and then I'll ask the second one.
So I have really spent my career in academic medicine. In academic medicine, I was involved with clinical care my entire career, as well as education of medical students and residents. In addition, clinical research, and then developing different programs. And then I had the unique opportunity in 2015 to shift to public service in Pennsylvania and public health, and then had the amazing opportunity now to serve at HHS. So I certainly would encourage people who are involved in clinical care to participate in education and in research when they can. I mean, there are many medical schools that have voluntary faculty that are involved with medical student and resident education and have opportunities to do clinical research. And I certainly would encourage people to get involved with public health. You know, there are several lessons from the COVID-19 pandemic. One is that we're all interconnected. And the second is the critical importance of public health at all levels, at the local, state, national, and international level. And I think there is an opportunity for clinicians to get involved with public health, particularly at the local and state level.
Admiral Levine, Heather King asked, Dr. Levine, can you offer any tips to providers and others in ambulatory settings on how best to let LGBTQI patients and families know we are supportive and we are a safe space?
Right. I would specifically point that out in potentially in literature that you have, that you either hand out or that might have on the internet, that you are a safe space for LGBTQI+ individuals and families. You might consider, putting a pride flag, at the front desk, one of the little stickers or something like that, or maybe a trans flag or one of the different flags. And then I would be really careful in terms of your questionnaires and in terms of the education of your staff to be able to ask questions in the right way. So in terms of gender, and have different options in terms of asking about sexual orientation and gender identity, or SOGI questions. There are very well-established ways to ask SOGI questions, sexual orientation and gender identity. There was recently an article from the National Academies of Science, Engineering, and Medicine about that, and standards for research, but also for clinical care. And I would be careful to use those. I would also have resources available. So if you had an LGBTQI plus young person or adult, say what resources might be in your area. Are there any support groups? Is there a community center? Where could someone access gender affirmation treatment? I would have those resources available to be able to give to the patients that you see.
You spoke a bit about language and the importance of language, which leads right into this question from Louis Greenstein. Louis says, Dr. Levine, native Pennsylvanian here. Thanks for your work in Pennsylvania. Can you talk about the intersection of race and LGBTQ plus community, specifically as the AMA recommends language changes in the presenting of cases, such as talking about the person first, then describing their condition, rather than the other way around? What are some of the changes in language relating to the LGBTQ plus to assure better outcomes? So any insight when it comes to language, especially at the intersection of race and LGBTQ plus communities?
Well, thank you so much for highlighting that intersectionality, because we see that with all of our work in health equity. And I just want to emphasize health equity is foundational. It's fundamental to everything that we're doing at the Department of Health and Human Services. It's not like we do other work and then on Fridays we look at health equity. Health equity is the foundation and to everything that we're looking at, for every grant, for every funding opportunity. Health equity is built into it, and it's an absolute priority for the secretary and for our whole department. And so that includes that intersectionality, for example, between race and sexual orientation and gender identity. And so I think it is really important how you ask questions and what order you ask questions and how you use that language in terms of clinical work and in terms of research. And again, there was just a recent article and paper from the National Academies of Science, Engineering, and Medicine about that. And we had a big discussion and roundtable about that through the NIH, and really involving the CDC and all of our different divisions. I do want to emphasize that, we have not made progress unless we've all made progress. And there are some particular communities within our LGBTQI plus family, our rainbow family, that are particularly vulnerable. And I've been mentioning some, the youth, seniors, immigrants, but particularly LGBTQI plus, for example, transgender women of color. And they are at risk not just of harassment or bullying or discrimination, they are literally at risk of violence and murder. And we have to deal with this intersectionality, again, from a health perspective, from a public health perspective, and really all perspectives, all of the determinants of health, as Dr. Graham had talked about, in order to make progress as a society.
Right. And I mean, there are certainly other topics and issues I want to get to in this conversation. We have Jeffrey Roche here. There are certainly a lot of Pennsylvanians who came to show out in this conversation. Jeffrey Roche says, Dr. Levine, you make us Pennsylvania proud, and we are here in support of you. My question is, can you share how you will lead vital work in reducing opioid death nationally, as you did so well in Pennsylvania?
Thank you so much. So this has been an absolute priority for me in my time in Pennsylvania and now nationally. We had made some progress in Pennsylvania as a nation in 2018, 2019 in terms of the overdose crisis. But we have lost ground, frankly, in many states and as a nation during the COVID-19 pandemic. In the last data that we have seen in a 12-month period, over 107,000 people died of drug overdoses from 2020 to 2021. And that trend is continuing. So we have to really take an all-of-government approach and to look very broadly. So at the Department of Health and Human Services, we have a 4-point strategy, 4 pillars, so to speak. One is prevention, working on community-based prevention of substance use and the disease of addiction, looking at school prevention, continuing to work with the medical community on the safe and effective and careful prescription of opioid pain medications, which we had been doing so well in Pennsylvania and we're working on nationally. So prevention efforts. The second is a new pillar of harm reduction. We have to emphasize evidence-based harm reduction, including the life-saving medicine, naloxone, which I work so much on in Pennsylvania and we're working on nationally, on fentanyl test strips, which is new, looking to detect fentanyl-related compounds, which are leading to so many of the overdoses and deaths that we're seeing. And then evidence-based harm reduction with syringe service programs. There are still too many states, including Pennsylvania, where syringe service programs are not legal through state law. Pennsylvania has 2 in Philadelphia and in Pittsburgh, but only because of local ordinances. We need Pennsylvania and many other states to legalize syringe service programs so that we can work on embedding naloxone distribution as well as linkage to care for HIV and hepatitis, and linking people to evidence-based treatment. That brings me to the third pillar of treatment, particularly medication for opioid use disorder, and then finally recovery. So those 4 pillars, and that's what we're going to be working on really throughout the administration.
Thank you so much. I want to jump now to monkeypox. What more can be done right now? Are we doing enough? And how do we make sure we're not, fumbling it like during the early days of COVID?
Well, we are really working very hard across HHS and across the administration on monkeypox. As the secretary talked about a couple of days ago, it is a significant public health threat. And so we need to work on all the different tools in the toolbox that we have in public health. So one is in terms of containment. We have significantly expanded testing, including testing now through commercial laboratories so that people can be diagnosed if they have monkeypox. The other aspects of containment are isolation and quarantine isolation of people who have monkeypox and then quarantine of those who've been exposed. Now, monkeypox is not transmitted the way that COVID is transmitted. It's not transmitted through respiratory droplets through the air. It's transmitted through close contact. And so isolation and quarantine mean different things than they did during COVID-19, but they are still important pillars. The second is through mitigation aspects. And then the third, which is critical, are our medical countermeasures. And that includes our safe and effective vaccine of Jynneos, and through treatment with VPOX. Now, unfortunately, we are using all of the stores that we have of the Jynneos vaccine, which was developed for smallpox, but can be effective in preventing monkeypox. And we are distributing those through the CDC to impacted communities, and then where we anticipate communities will be impacted in the future. And then we're doing that same type of distribution for the medication. And we're working on increasing the distribution of both. Now, we had certain stores of Jynneos, again, not because we were anticipating monkeypox, because for smallpox. And then we're working with the manufacturer to buy more. And then we're working with the manufacturer, which is in Europe, to produce more. And then we're going to purchase all that we can. And then we're going to be looking at different ways that we might increase the production and distribution and administration of the vaccine, as well as the medication. So the president is committed, the secretary is committed, we're all committed to addressing this. It is not something that we would have anticipated in the past. That would have been a significant public health threat, but it is, and we are working on it.
Thank you. A quick reminder to those who are watching: if you have questions, feel free to put them in the Q&A, and I'll make sure I'll make sure I ask them so that Admiral Levine has an opportunity to answer them. So sticking to monkeypox here, do you have any concerns right now about the language used around monkeypox or how we are communicating it, especially with the spread? We speak a lot about monkeypox, especially amongst men who have sex with men, but we know that anyone can have monkeypox. Are you concerned with how we are communicating it right now?
Well, it is important to remember that. So thank you for emphasizing that, is that anyone can get monkeypox. But the spread has been primarily in the gay and bisexual community and men who have sex with men. That just happens to be because where it had started, where the spread had started in Europe and has come to the United States. But anyone can get monkeypox. And so we are being very careful with our language, and we do want to make sure that the LGBTQI plus community is not stigmatized the way it was stigmatized with HIV. So we have to be very careful and cautious with our language and with our communications, but we do want to make sure that we are communicating effectively to the gay and bisexual men and men who have sex with men communities who currently are most impacted.
And then Christina Beach asks on this issue, does HHS have recommendations on messaging that does not stigmatize people and communities? And do you have recommendations on language for not just providers, but just those of us who are watching who may not be in the healthcare field, but want to make sure we're doing our best to not run into the misinformation we saw boil over with COVID?
So that is entirely correct. So there is language that you can find on the CDC website, which is both for the public and for providers in terms of messaging about monkeypox. But I do want to highlight this issue of misinformation and disinformation. This is something which has been an enormous threat with our medical and public health efforts with COVID, as a potential threat in terms of monkeypox, and really to many of our activities in public health. And so we really need to be vigilant about our communications with local, state, and federal public health officials, but we also need the media and the public to be very vigilant as well in terms of how they consume media, and particularly social media, and what language they use. This has been a particular emphasis and priority for our Surgeon General, Vice Admiral Vivek Murthy, who has been putting out literature about the challenges with misinformation and disinformation, which has been so particularly prevalent now for public health issues.
And are you worried, or tell us about your worries when it comes to stigmatization of the LGBTQI community because of monkeypox? I mean, right now we're in an environment where, the trans community is quite honestly under attack. There's so much stigma going around. There's so much that is being, so much hate, so much vitriol, and now we are having that compounded by what's happening with monkeypox. Are you concerned? What are your biggest concerns right now?
Well, I am concerned both about the challenges that the LGBTQI plus community is facing because of politically motivated attacks that we were discussing previously, particularly in terms of trans and gender diverse youth and our general in our community. But I'm also concerned about the potential for stigma and attacks because of monkeypox. And so it is so important to emphasize that anybody can get monkeypox, and how it's transmitted, which is through close contact, and what people can do to protect themselves, and what local, state, and federal public health and international public health authorities can and need to do in the future. And that information is all available on the CDC website.
I want to take a quick jump to climate change, because I know we talked a little bit before this and you wanted to make sure we had the chance to talk about it. Can you tell us, in the amount of time we have left, kind of briefly, what HHS is doing, right now with climate change? Tell us about your concerns and tell us, because it is just so hot.
That's exactly
so
right.
Unbelievably hot.
It's very hot. So climate change is here now, and the health impacts of climate change are here right now. They are not an existential threat, which means maybe a threat sometime in the future. They are here right now. And you can see that with the temperatures that our nation is facing, and that Europe and the rest of the world are facing now. I have actually been able to travel the country over the last 6-9 months and have seen heat-related challenges in Seattle, heat-related challenges in the Bronx and New York City, heat-related challenges in San Jose and Los Angeles, in Phoenix and Albuquerque, in Atlanta, in Orlando, and in Miami. Really throughout our country, we're seeing these heat-related health impacts. And so we have a new office of climate change and health equity, which is going to be looking at these heat related challenges and other challenges posed by climate change, which could include forest fires, the smoke from forest fires. It could include sea level rise, and it could include hurricanes and tornadoes and other weather events that are stoked, that are exacerbated by climate change. And it's those same communities that we've been talking about, those same disadvantaged communities which face so many other challenges in terms of health equity that bear the brunt. And that's why our specific office is climate change and health equity. One of the specific things we're doing is we're working with the medical community, both in the government and in the private sector, on both developing resilience to the impact of climate change and actually working to control their carbon footprint and to decarbonize. And we are working that again with the VA and the Department of Defense, but also through an association with the National Academy of Medicine. We're working on that with the private sector as well. The health industry and the health system in our country relates to 8.5%. It produces 8.5% of our carbon footprint. So it's such an important aspect to address. And that's one of the things that our new office is doing.
Admiral Levine, we have two more kind of reader questions or viewer questions I want to get to before we close out here. The first one's particularly specific. Kyler Phillips asked, thank you so much for taking the time to speak with us, Admiral Levine. The FDA recently published a report that, without adequate evidence, suggested that many compounded hormones therapies could be considered for the agency's difficult to compound list, and thus made unlawful to compound. With this in mind, are you concerned about trans individuals' access to compounded therapies?
Well, this is an important issue that has come to my attention, and I'll be pleased to discuss it with the FDA, and we'll try to work through this process.
Thank you. And to kind of wrap us up here, Crystal Jakowiak asked, Dr. Levine, how do you remain hopeful in the current climate in the U.S., where we're seeing just so much anti-trans legislation being introduced?
Well, I am by nature a positive and optimistic person, and I have hope for the future, for our nation, for the world, and part of this discussion, our LGBTQI plus community. I also am very realistic of the challenges ahead. But in the face of pushback, in the face of the discrimination that I see, what that does is I sublimate it, and I'm able to turn that into further motivation to work for health equity for everyone in our nation and work for health equity for our LGBTQI plus community. It's a choice that I make. I make a choice to be positive and optimistic and to work towards the future.
And are there any other concrete examples or policies or things that just continue to make you hopeful? For instance, I know 988 is a big win, especially
Absolutely.
in terms of helping fight or reduce suicide amongst people in the trans community. Any other examples like that just keep you going?
Well, the working for President Biden and Vice President Harris, and working for our secretary in such a progressive, supportive administration keeps me going. I had the amazing opportunity to stand behind the president and watch him sign the executive orders for support of the LGBTQI plus community a month or so ago, and to shake his hand and the hand of the vice president, and to witness that historic event. And so those are the type of experiences and the type of work that gives me hope for the future.
And with that last thought, I think we're out of time, but Admiral Levine, thank you so much for chatting with us, for answering so many of these questions, and just thank you for all of the work that you're doing. And I want to say a special thank you to our audience out there for so many great questions, and thank you to our event sponsor, YouTube, and to all of you who joined us. We hope you join us again, our next virtual event for our 2022 Status List Spotlight Series will be taking place on September 20th, when my colleague Usha Lee McFarling will be sitting down with Dr. Kirsten Bibbins Domingo, who's the new editor-in-chief of JAMA and the JAMA Network. It should be a pretty interesting conversation to hear more about the kind of work that she has done at the helm of JAMA. For more information, you could turn to our website. Once again, I want to say thank you to everyone. Thank you so much, Admiral Levine, and thank you. And everyone, please stay safe and be well.